The number of coronavirus cases around the world is approaching 1 million. The United States is worst hit with more than 200,000 infections, and the death toll has risen by a record 884 in the last day alone. Worst hit? New York City.
The epicenter of America's coronavirus outbreak. The streets of New York are deserted. But ambulances are a constant presence on the streets. The state's death toll has doubled in just 3 days. A refrigerated truck was brought in to help this Brooklyn hospital deal with a sharp rise in fatalities.
Hospitals are running out of medications. Some hospitals don't have protective gear for staff or family members of patients that come to the hospital. We're running out of medications, we're running out of equipment, and we're even running out of oxygen, which is something that patients that have COVID-19 need.
The White House is projecting that the virus could claim up to 240,000 lives across the country. Despite this, the pandemic authorities are urging restraint.
And if you are going to wear a face covering when you go out, please understand you still don't need an N95 mask. And if you take one of those N95 masks, you may be taking it out of the hands of a healthcare worker who desperately needs it to care for patients.
Union leaders are warning that frontline healthcare workers are at risk.
We are here to say that our members are afraid to go to work because safety protocols aren't keeping them safe. That is why we're calling for hazard pay. We are trying to keep ourselves safe. We are trying to keep our coworkers safe. We are trying to keep our community safe.
Healthcare workers who didn't get access to a mask are now stuck at home.
So I haven't really been given too much direction besides just wait it out. Stay home, keep yourself quarantined and wait it out. And if you get worse, if you can't breathe or, you start having raging fevers, call 911.
President Trump is warning Americans they face a very tough and painful 2 weeks, and he is not given to understatement.
Well, journalist James Reinl joined us from New York and gave us this assessment.
I think you can say that the mood in New York City is becoming increasingly concerned, and I think that goes nationwide as well. In the last 24 hours, there has been a discernible shift in the emphasis on the scale of this crisis. For example, previously, President Donald Trump, he was talking about, the possibility of there being some cure being found for coronavirus, and perhaps saying that the crisis wasn't going to be as long-lasting and wasn't going to tank the economy for such a long time. Now, that has changed in the last 24 hours. We've just had President Trump speaking to the nation again, and he said it's going to be vicious. The projections for the total death toll from this crisis that have come out of the White House suggest that as many as 100,000 or up to 240,000 people could die. And that is even if we start obeying the social distancing rules and everybody does stay shut up in their apartments, not just here in the worst hit part of the country, the tri-state area of New York, New Jersey and Connecticut, but in these other parts of the country, like Florida and New Orleans, that are starting to show bigger signs of epidemics there.
Well, Dale Fisher chairs the World Health Organization's Global Outbreak Alert and Research Network. He joins us from Singapore. Welcome to DW. What do you make of Britain's lack of testing?
I'm not there. I'm not sure how much testing is being done. But the one thing that concerns me is when we say test, it's about what you do with that test. And the thing that actually concerns me the most is when people are found in countries across the world to be positive, they're generally sent home. We know that up to 80% of cases are mild, and a lot are in young people, and it's very difficult to completely isolate yourself at home. We in the 5 countries where there is quite a flat curve and relative control, we all isolate our cases in hospital, but when that capacity is breached, then we have community isolation centres. So this is all through China now, Hong Kong, Taiwan, South Korea and Singapore. So to me, it's what you do with the test.
And given that there is no cure, why is testing so important?
Well, exactly. If you don't do anything with it, then you could argue what's the point in testing? The reason to test is you can identify the cases and you can take them out of society, and you keep them out until they're cleared, and then they can come back in. It's not a penalty or a punishment to isolate people. Isolation is a genuine infection control intervention to prevent spread. So you can either shut down your whole community and tell everyone to self-quarantine, or you can pull out the positive ones, isolate them, and that allows society to function as it is in parts of Asia.
Now, we see TV pictures every day of people in hazmat suits disinfecting the streets as part of a response to this. This is an approach that I think you're not necessarily keen on.
No, I mean, maybe it's a community image that we're taking it seriously. I don't know. It's certainly not anything that we recommend. We don't believe people are catching it from the ground. And you know, it makes no sense. It's quite wrong to spray people with chlorine. I saw images of, I think, refugees being sprayed. You know, that's wrong. I think it needs to be stopped. I'd rather see images of people, you know, washing their hands and distancing and things like that. That's the community response, not spraying chlorine everywhere.
Let's have a look to the medium and long term. How should governments avoid a resurgence in cases in this pandemic and indeed prepare for the next one?
I'm not sure what you mean by the next one. If we were to face this one first, you know, so many countries or cities are under lockdown, and this lockdown really needs to be seen as an opportunity. Firstly, you will stop transmission. If you separate everyone and say don't mix, transmission will eventually burn out. There'll be household clusters and things, but it'll stop. You'll also have an opportunity for your healthcare system to recover. You'll get your ventilators back. You know, people will go one way or the other. They'll come off the ventilator, hopefully successfully, but some will die. But your health system can recover. But I think what's most important is during any lockdown period is that you reboot your response. You look at your testing. You look at what you're going to do with positive patients. You look at the laws. You know, do you have public health powers to be able to do what's the right thing for the public? How are you going to do your contact tracing? What are you going to do with contacts? All these sort of things can now be debated because you're locked down and you've got a sort of a breather period. But if you just open up again, right, and things are the same, then it's going to come back and history will repeat.
Okay. It's important to learn the lessons. Good talking to you. Thank you for joining us. Dale Fisher from the World Health Organization. Well, here in Germany, a search for a group of researchers has turned a hard-hit town into a study area. They're looking at everything to get information about how the virus is spread, who gets it and what stops it.
This is Germany's Wuhan. Heinsberg is the German epicenter of the coronavirus outbreak. Now it's about to be turned into an open-air laboratory.
As one of the country's worst affected regions, Heinsberg has reached the point where we can now see new infections declining. So here, for the first time, we can ask the question, how many infections went undetected? How high the ratio of those really is who are sick without ever being diagnosed.
Doctors are teaming up with pollsters to analyze a group of 1,000 people in the small community of Gangelt. Following carnival celebrations in February, the town saw a sudden surge of coronavirus infections. Those responsible hope the mistakes made back then may now produce some good for others.
In the end, maybe we won't just be remembered for being the region where things were really bad. Maybe we'll be remembered for handling the situation well, doing as much as we could.
It's hoped taking samples from all aspects of daily life will shed some light on how fast and in which ways the virus spread.
The problem is that we are currently relying too much on mathematical models. And if only one factor turns out to be wrong, the whole calculation model collapses like a house of cards.
The team of scientists hopes to be able to present the first concrete results on actual infection ratios by the beginning of next week.
Well, here are some more of the latest developments in this pandemic. The total number of reported infections worldwide has risen to almost 940,000, with more than 47,000 deaths. This year's UN Climate Summit has been postponed. The COP26 talk scheduled for Glasgow in November has been pushed back to next year. And Brazil has reported the first coronavirus case amongst its indigenous population. A woman from the Kakama ethnic group in the Amazon rainforest has tested positive. The president of the Philippines has ordered police to shoot dead anyone who causes trouble in lockdown areas. Rodrigo Duterte's televised speech came just hours after a group of people were arrested in a Manila slum for demanding the government do more to help feed the poor. The coronavirus pandemic has plunged the aviation industry into an unprecedented crisis. Airlines have been forced to ground their fleets as borders are closed and passenger numbers plummet. British Airways is the latest to take drastic measures to try and ensure its survival. It's reported to be planning to suspend about 36,000 staff, although the company has stressed there will be no redundancies. This week, BA temporarily halted flights from Gatwick Airport, the UK's second busiest. Well, finance correspondent Conrad Boozen at the Frankfurt Stock Exchange has more. Welcome, Conrad. How are markets reacting to this news?
Good morning, Phil. Well, the shares in International Airlines Group, which is the parent company of British Airways, are up this morning. But the whole sector, I can say, is pretty stable this morning on the stock markets all over Europe.
Now, BA, of course, is not the only carrier suffering. Give us an overview of the sector, would you?
Well, of course, this sector was one of the hardest hit in this crisis. It was also one of the first hit when the corona epidemic broke out. It doesn't even help that fuel at the moment is super cheap because of the decline of the oil price. If you don't have passengers to transport, if the amount of cargo is reduced the way it is right now, you simply don't have to fly. You have your flights grounded. It doesn't really help that fuel is cheap. Here in Germany, the situation for Lufthansa seems to be stabilized at the moment. 87,000 employees of Lufthansa have entered the reduced work hours scheme called Kurzarbeit here in Germany. That's a scheme that's supposed to help businesses in trouble. That's when, the taxpayer, the state, takes on the wages of those workers. Lufthansa is also considering to apply for emergency aid by the government. Air France, KLM, the French-Dutch airline, already has applied for emergency aid.
So clearly this is devastating for this particular sector. Once we're out of this crisis, I'm presuming that this sector is going to look very different because not every airline is going to survive.
Well, yes, that's a fair presumption. We already have seen a couple of casualties in the UK. Flybe, the regional airline, has gone out of business. Today it was reported that the small fleet of Thomas Cook is going under administration, and we are probably going to see more businesses, end. It has to be said generally business models which were not super sound before the crisis and which did not have very sound financing will find it difficult to survive this crisis.
Conrad Boozen at the Frankfurt Stock Exchange, thank you so much. Well, a third of the world's population is now under some form of coronavirus lockdown, changing life, not just for us, but also for our pets. Millions of our four-legged friends are now getting extra quality time at home with their owners, and lots of us without pets are now reconsidering that position.
Long days stuck at home may be frustrating for us humans, but many of our four-legged friends have never had it so good. Leo from Florida is lapping up the extra attention.
During this rather tricky time, Leo brings a lot of joy and kisses.
They are definitely thoroughly spoiled because they're not used to seeing us and being a whole day with us. So they're totally spoiled. Loving their treats, loving spending time with the family.
In London, Simran's pooch can't believe her luck.
everything is gone completely out of the window.
As long as social distancing is practiced, there's no reason to give up walkies. And it's not just dogs who are enjoying more family time.
Quilly is usually asleep at this time. She is a night owl or a night hog, but since all the kids are here and everything, we thought we'd take her out.
During times of crisis, pets can be a great comfort. That's why across the world, animal adoptions are now soaring.
We've seen nearly a 300% increase in adoptions and interest around foster care applications. And it's been really motivating to see many people turn to animals for some companionship over the next few weeks, if not months.
Thanks to the increase in demand for new furry family members, many of this shelter's cages are now empty.
I'll leave you now with a look at some of the world's normally busy streets and public spaces silenced by the coronavirus pandemic. Have a good day.